Hello classmates, welcome to the online class of Chinese medicine gerontology. Today, we will study the second part of congestive heart failure. Focus on learning the syndrome differentiation treatment of coronary heart disease. There is no name for heart failure in Chinese medicine, but according to symptoms of chest tightness, dyspnea, and anemia, which are mostly present in patients, they mostly belong to the category of chest pulsing palpitations, aspiration syndrome, anemia, and failure. The dialectical key points are the following three aspects. The main symptoms are distinguished. If the shortness of breath is mostly due to lack of lung gas, drinking water to the lung is lost, or the kidney gas is lost, and there is no right to accept. If the shortness of breath is shortness of breath, panic, timidity. In accordance with syndrome of deficiency of breath, if the lips are dark purple, shortness of breath, sputum, stasis under the throat, anemia of the lower extremities. It is a kind of blood stasis. Heart palpitations are mostly caused by the lack of energy, exhaustion of heart energy, and lack of patriarchal energy. If the heart is palpitation and night sweats, fatigue, and upset, it is both qi and yin deficiency. If it is pale, anemia, and cold, and the limbs are cold and astringent, it is heart and kidney yang deficiency. If it is accompanied by edema, irritability, sweating, limbs is a critical syndrome of yang collapse. The anemia of this disease occurs more slowly, usually starting from the lower limbs, and it is difficult to sink. It is generally evidence of in water. If the patient's limbs are cold, the low li wan gu is spleen deficiency. Shortness of breath, coughing, impotency is lung gas loss. Shortness of urine is an advised symptom of bladder gasification. Distinguish yin-yang qi and blood yin-yang qi and blood deficiency is a fundamental cause of heart failure, and heart qi deficiency is the most basic pathogenesis of heart failure. Heart qi deficiency characterized is by shortness of heart and palpitations, especially movements. Heart qi deficiency combined with cold limbs is heart yang deficiency. Heart qi deficiency and dizziness is heart blood deficiency. Heart qi deficiency and upset is less heart yin deficiency. The evolution of syndrome differentiation. The disease is mostly secondary to other diseases, with a long course of disease, easy to repeat, and chronic onset, which is gradually increasing. The cause of the disease is lingering, and every relapse can damage the heart and yang, and increase the heart failure. Some acute diseases can cause heart and yang sudden failure. Its onset is sharp and the condition is critical. Pathogenesis transformation is mainly the change of both positive and evil, and the key is the ups and downs of upright qi. The ups and downs of heart qi and heart yang. If the yang qi gradually recovers, the evil qi gradually disappears and the condition improves. If the heart qi and the heart yang gradually decline, and the evil qi gradually flourished, then the heart yang is weakened. The yang qi collapse. The yin and yang are separated, or the yin and yang are exhausted and die. Early heart failure mostly manifests as cardiopulmonary qi deficiency, which gradually affects the spleen and kidney. Later, the heart and kidney yang deficiency is the main cause, accompanied by different degrees of blood sputum and water blockage, which forms a syndrome of deficiency and reality. Aiming at the pathologies of false stasis, phlegm, and water in this disease, the treatment methods of supplementing deficiency, removing phlegm, diuresis, and promoting blood circulation are adopted flexibly, and both the symptoms and the deficiency are applied in a specific classification treatment, according to the difference of the ill health of the disease. It can be roughly divided into 5 syndromes, which can effectively guide the clinical. Let's take a look at the specific differentiation of governance. The acute exacerbation period is more acute, and the condition is more serious, and it is easy to change the syndrome. The syndrome type is mainly due to iron deficiency and water drink syndrome. The drinking heart syndrome is more common. The stable condition is relatively stable, and the medium and long-term effects are remarkable. The syndrome types are mainly Qi deficiency and blood stasis syndrome, and Qi and Yin deficiency, which are often used to benefit heart Qi, nourish heart Yin, and promote blood circulation to remove blood stasis. Improper or untimely treatment of heart failure. It is prolonged to the emergent syndrome of Yang Tuo Yin Jie Zheng, which requires emergency rescue treatment. The main points of differentiation of each syndrome type. One is to grasp the characteristics of the main cause, such as the Yangshu Shui Kun Zheng and Shui Yin Ling Xing Zheng, which are caused by the overflow of water vapor, but the main cause is different. The former is characterized by palpitations, shortness of breath, obvious anemia of the lower limbs, and even lomosacral and anemia around the body. The sex main syndrome is accomplished by spleen and kidney yang deficiency syndrome. The latter is mainly characterized by cough and asthma, palpitations, shortness of breath, especially in shortness of breath. Second, whether in the acute phase or in the remission phase, the syndromes of both heart Qi Yin deficiency and blood stasis run through. The third is to identify the critical syndromes of Yang Tuo Yin Jie Zheng and timely rescue. The main manifestations of Yang Tuo Yin Jie are panting, palpitations, restlessness, sitting and resting, sweating or sweating like oil or cold sweat, and extremities, cold, spitting, salivary or pink sputum, less urine and even consciousness. The tongue is pale or cannot be extended. The pulse has no roots or the pulse is desperate. On the law, to benefit Qi, nourish Yin and warm Yang. Adjust the lungs, heart, spleen and kidneys. For those with anemia, take more spleen to warm the kidneys. 补肺益肾，纳气利水，寄生肾气丸 add and subtract. For blood stasis, taking into account that the disease is mainly Qi deficiency and blood stasis. 补阳还五汤 addition and subtraction. For the critical syndromes of Yang Tuo Yin Jie, the prescription of 回阳固脱 is urgently administered, and 六味回阳饮 combined with 生脉散 is added or subtract. However, due to the critical condition of this syndrome, the prognosis is extremely poor. Attach needle intranevous or intravenous strip and cooperate with Western medicine-related rescue measures, representative prescriptions, and addition and subtraction of meditation. Master key prescriptions. The first is 十皮饮. The prescription is a well-known prescription of warming yang and excretion water. 附子 and dried ginger is despite cold. 黄芪、茯苓、白术、甘草 can strengthen the spleen and ignite qi. The second is 寄生肾气丸. 熟地黄、山茱萸、山药 nourish the liver and kidney. 附子、肉桂 warm the kidney yang. 泽泻、茯苓、车前子 purine wetting and water. 牡丹皮 clearing the liver and fire. 牛膝 strong waist and knee, diversion of water. However, the strength of this side is relatively weak, and it can be combined with 真武汤 to add or subtract treatment or make some adjustments. For example, those who obvious cough and asthma. 8. 葶苈子 桑白皮泻肺. Those with obvious abdominal illness go to 熟地黄麦冬 plus 苏叶木瓜焦槟榔白术 spleen and qi. Those who are partial to lung deficiency can add 黄芪 to benefit qi. The third is 生脉饮. This prescription is the representative prescription of nourishing qi and nourishing yin. As a basic prescription of congestive heart failure, it will not be described in detail and must be mastered. The fourth is 补阳还五汤. The prescription is the representative prescription of 益气养阴, and that such of original prescription should be followed as much as possible. Read-gloss should be large. In addition, it is 六味回阳饮, which is saved by 附子、炮姜、回阳救逆、生龙骨、生牡蛎、收敛固涩、当归、活血化瘀、熟地黄、山茱萸 nourish liver and kidney. In addition to traditional drug therapy, congestive heart failure emphasizes comprehensive treatment, such as diet therapy, cardiac rehabilitation therapy, and physiology guidance. It is beneficial to carry out cardiac rehabilitation treatment for patients with clinical stable heart failure. Cardiac rehabilitation treatment includes a sports-based rehabilitation treatment plan specially designed for patients with heart failure, but it must be carefully monitored to ensure that the patient's condition is stable and safe, prevent and deal with possible situations in a timely manner. Prevent and deal with possible situations in a timely manner. In addition, if conditions permit, patients with heart failure should be included in multidisciplinary management. The multidisciplinary treatment plan is to combine the joint effort of cardiologists, physiologists, nutrition, sports, rehabilitation, specialties, primary doctors, urban committees and rural primary medical institutions, nurses, patients, and their families to integrate patients, including physical, mental, sports, nutritional, social, and spiritual aspects. Treatment to significantly improve the prevention and treatment effect, improve the prognosis. Carry out physiology treatment. Encourage patients to adjust their emotions, make the mood comfortable, relieve concerns, and avoid nervousness, excitement and panic and other bad emotions. Building confidence in defeat disease and actively cooperate with treatment. Okay, that's all for today's lesson. Thank you all.